Hi everyone, this is Sujata. In this video, we will solve 5 questions on upper and lower limb nerve lesions. Question 1. A 70-year-old woman falls on her outstretched hands. She has pain and tenderness over the anatomical snuff box. What pathology will be seen in this patient? Options are option A, wrist drop, option B, avascular necrosis, option C, median nerve injury, option D, dislocation of the radial head. Correct answer is option B, avascular necrosis. So this is a case of fouche injury or fall on outstretched hand injuries, which are associated commonly with fractures of the wrist and forearm. She has fracture of the scaphoid bone, which presents with pain and tenderness over the anatomical snuff box. Scaphoid fractures are associated with risk of malunion, non-union, and avascular necrosis. Question 2. A 45-year-old man suffers fracture of the surgical neck of humerus. What type of deficit will be seen in this patient? Option A, initiation of shoulder abduction. Option B, wrist drop. Option C, sensory loss over lateral arm. Option D, sensory loss over lateral forearm. Correct answer is option C, sensory loss over lateral arm. This patient has fractured surgical neck of humerus, which leads to injury of the axillary nerve. Axillary nerve is motor to the deltoid muscle, which causes abduction at the shoulder joint above 30 degrees, and it also supplies sensation to the lateral arm. Question 3. Following a difficult labor, an infant is born with upper limb palsy. His arm is adducted and medially rotated. There is sensory loss over lateral arm and forearm. In the figure, which is the location of his injury? Correct answer is option A, which stands for the superior trunk of brachial plexus that is formed by nerve roots C5 and C6. This infant is suffering from Erb Duchenne palsy and presents with what is called as a waiter's tip deformity, where the arm is adducted and medially rotated. There is sensory loss in the musculocutaneous nerve distribution. In the figure, point B is the posterior chord of the brachial plexus. Point C is axillary nerve, point D is radial nerve, and point E is the inferior trunk of the brachial plexus. Injury to inferior trunk or point E will lead to Klumpke's palsy. Question 4. A 55-year-old woman with hypothyroidism presents with tingling and numbness over her hand and weakness in thumb movements. Tinel sign is positive. What deficit will be seen in this patient? Option A, sensory loss over dorsum of hand. Option B, sensory loss over palm of hand. Option C, sensory loss over palmar surface of the index finger. Option D, sensory loss over the hypothenar eminence. Correct answer is option C, palmar surface of index finger. This patient is suffering from carpal tunnel syndrome, which is caused by compression of the median nerve. In carpal tunnel syndrome, sensory loss is not present in the palmar area because the palmar cutaneous branch of the median nerve is not in the carpal tunnel, whereas there is still loss of sensation on the palmar or ventral surface of the lateral 3½ digits, which are supplied by the palmar digital cutaneous branch of the median nerve, which passes through the carpal tunnel. Question 5. A 25-year-old man suffers from fracture of the fibula. What type of deficit will be seen in this patient? Option A, sensory loss on skin between first and second toes. Option B, sensory loss over heel. Option C, loss of plantar flexion of the feet. Option D, loss of knee flexion. Correct answer is option A, loss of sensation on skin between first and second toes. This patient is suffering from common peroneal nerve injury, which is often associated with fractures of the fibula. He will have foot drop along with loss of sensation on posterolateral leg and dorsum of feet, which includes the skin between first and second toes. Hope this video helps you solve questions on upper and lower limb nerve lesions. Thanks for watching.
Hi, I am Sujata. If you enjoyed this video, then you will love the courses I authored for Achievable. Achievable Step 1 USMLE course is a great learning program if you are looking for high-value, information-rich study materials that use technology to help you pass the exam. I have written the course exclusively for Achievable, including all the medical content that is covered by the USMLE Step 1 exam. It includes more videos just like these to cover key topics, as well as an inbuilt study planner to keep you on track. With the help of hundreds of chapter review questions, our spaced repetition algorithm personalizes the content just for you. Our course is very competitively priced, and you can try it for free first to see if the style is right for you. Follow the links in the description below to get started.